Director of the Iowa Association for the Education of Young Children. I thank Vicki and Bethany and the other staff here at Oak Academy for hosting us today. We're here to draw attention to a situation that negatively impacts the quality of care and education that is received by our nation's youngest children. The child care compensation crisis is real. Programs typically can only afford to pay just over minimum wage to their child care teachers. This impacts the quality of the teachers available to them, which of course impacts the care and education that's provided to our children, the babies, toddlers, preschoolers, and after-school care providers. A national survey of early care and education, initially released this past year from the U.S. Department of Health and Human Services, shows that our national mean child care wage is just over $10 per hour. It's a bit more for state or federally subsidized programs such as Head Start, but it does not approach what similarly trained public school teachers and others in helping professions are receiving. Our Iowa data shows similar numbers, with very few of this workforce receiving health insurance or other benefits. Child care is often described as a family expense, and a family expense as large as paying college tuition. But if you've had a child of your own, you know that babies require incredible amounts of care. Our state licensing ratios allow one caregiver to take care of 4 infants at one time. During the course of this week, these 4 babies likely need 2 caregivers just to cover all the hours that a program is in operation. With very minimal benefits and paying those 2 people around $10 per hour, these 4 babies' caregivers will cost the child care program nearly $50,000 a year, not counting the food the babies need, utilities, overhead, materials, etc. That's over $12,000 per baby, nearly $250 per week per baby, just in salary and a few benefits for these 2 staff people. There's no doubt that our young families struggle to be able to cover their share of these costs. It's understandable that child care programs trying to operate on what young families can afford to pay and what the state reimburses them for low-income families will struggle to fairly compensate their caregivers. Young families of childbearing age are often at the lowest earning potential of their careers, and few can afford to cover the true cost of quality child care. With everything we now know about brain development and the importance of the early years, we understand how important it is for our children to have caring, educated teachers and caregivers in these early years. However, this workforce sometimes lacks motivation to earn college degrees, knowing that their salaries will remain in the $15,000 to $25,000 a year range. A national model, Child Care Wages, was created to address this issue. With the support of private foundations, United Way, and public funding, the Wages program provides salary supplements twice annually to child care teachers who have earned college credits and degrees in early childhood education, representing for them as much as a 10% salary increase at no cost to the programs or their families. The program requires teachers to remain in the child care program. Retention of teachers is another dimension of high quality, and in order to earn the supplements. Supplements are prorated depending on the level of formal education that a teacher or caregiver has earned. Both home providers and center teachers in eligible areas of our state can benefit from this program. The Iowa Association for the Education of Young Children is the administrative home and holds a license to provide wages in Iowa. The first supplements were provided to teachers in the Des Moines area beginning in January, thanks to the United Way Women's Leadership Connection. With the help of 5 funding partners, which are listed in your packets, we are expanding to 3 other pilots beginning this summer. Our hope is that the data from these 4 pilots will make a case to state policymakers and others that our essential child care workforce must be adequately compensated to provide the high-quality services our youngest, most precious children deserve. I'm very pleased to have some folks from Oak Academy here with us today. We're in their program, and we're happy that they're hosting us. Vicki Williams is the director of the Oak Academy Child Development Program. She's going to come up and join me and say a few words.